Catherine, thank you. It's Men's Health Awareness Month, and it's really important to get those checkups to prevent health problems and to spot some warning signs early for any potential diseases. So joining us is the medical director of the Buckeye Health Plan, Dr. Ron Suprenant. Good morning to you.
Good morning.
So talk about that. And I said that kind of in the intro only because I would assume all of that testing is kind of tied to age, previous history. Is there anything that you're saying every guy out there should be tested for?
No, it's not so much that, Dan. It's that we need to all be seeing our healthcare provider regularly and following their advice, because you're absolutely right. It's individualized based on age and risk.
So for guys that are my age, I'm 40, we should start to be aware that this has to be on the radar, these future tests.
That's right. And you can also be following healthy habits now. So we can talk about those more, but all of us can be doing things that we know prevent health problems.
Well, working out, good diet, etc. But should I ask my doctor for an EKG, or should I ask my doctor for preventative testing for something else down the road?
Well, they say that only about 40% of men even go for an annual exam. So if you don't go, you're never going to get the doctor's advice. If you'll go and then follow what your doctor recommends for you, that's the thing that we would suggest.
Well, and also, too, you hear a lot about colonoscopies, and you hear about, cancer checks, etc. For guys out there, you do need to be aware this is going to happen.
Right. Well, the most common cancers among men are prostate cancer, colon, lung, and skin. And all four of those cancers have either a method of preventing them, a method of early detection, or both.
Especially when you're in the summertime months, too. You talk about skin ailments, skin cancers. I mean, that can be the changing of a mole. That can be the changing of pigment on your skin. You have to have a dermatologist look you over. Might be uncomfortable, but you got to do it.
Well, many people just do actually rely on their primary care doctor to do that for them. But you're right, the dermatologists do a great job with that. And then, of course, prevention is avoiding the sun and using sun protection.
For the guys out there, and you talked about the numbers, a lot of us just don't want to go to the doctor, but we have to. What is that in our brains, ingrained in our personalities, that say we're not going to go to the doctor?
I think it's kind of having to face our own mortality or weaknesses.
And two, you can't take care of everything. You got to let help come and be there when you need it.
Absolutely. One thing that we mentioned, various diseases and prevention, I want to at least make a plug for smoking.
Yes.
Smoking is a huge factor for the two leading causes of health problems in men: heart disease and cancers.
But there are things out there, if you are addicted to smoking and nicotine, that can help you get away from that.
Absolutely. There's great treatment for smoking.
And those treatments vary. Explain a little bit more on that, if you will, please.
Sure. Well, what I recommend to my patients first is just try tapering off. But there are several different medications now that are extremely effective, and they can even be combined. So it's really important to see your doctor. Some of them are available over the counter, but you can get really a detailed plan with your doctor and get the support of your doctor if you go and see your healthcare provider.
Well, and just because you have a health ailment does not mean it's a death sentence. A lot of things can be managed, although that are chronic.
Well, absolutely. So, I mean, one of the biggest things that advances in medicine has been the reduced mortality from heart disease. So heart disease is still very common, but people don't die from it as they used to because we have so much better treatments and better prevention.
So a lot more on what we should be aware of as far as guys, and those health screenings down the road can be found on our website, also on your website. And we'll link those two together so you guys can check it out. But it's Men's Health Awareness Month, so we're hammering down the door.
Great.
Got to go to the doctor. Thank you so much.